Do you know how many patients have said to me, my doctor doesn't listen to me. He didn't even examine me. Have you ever had that happen to you? You're hurt and you just want to feel better. It's not like you asked to come through the workers' compensation system. It's not like you asked to come through the workers' compensation system. And now that you're in it, you can't seem to get what it is you need. Today, we're talking about why does it seem like all of the doctors and medical providers involved with workers' compensation are so bad? Well, number one, poor communication skills, right? Have you ever gone to a doctor's office and you can't even get a word out? Maybe you got 30 seconds out of what you wanted to say and the provider is cutting you off. I get it, like we're in a rush, we've got a lot of patients to see, but studies show that on average, patients can get the story out in 90 seconds. If you would just give the patient 90 seconds, you all usually can tell us everything that's happening. Now, sure, there are some patients that are a little bit long-winded. I get it. But the idea is at least let me get out a complete thought, right? So the providers aren't listening. They're rushing through appointments. Maybe they only have you in the room for 5 minutes. Right? There's no way that they were able to take a thorough history. There's no way that they were able to take an adequate physical exam. And all of that contributes to them having poor bedside manner. So what ends up happening? You walk into the exam room. They're not listening to you. They barely touch you. So there's no trust that's been formed. There's no rapport that exists. And so this interferes with a therapeutic relationship that you're supposed to have with your provider. I think the one that really gets most people, even mine when I'm a patient, is that the medical provider won't call you back. They won't return any messages that you sent on the patient portal. It's like, well, my word, I couldn't get 5 minutes in the exam room. I can't get my question answered outside of the exam room. What am I supposed to do? The second reason that most providers within the workers' compensation space are perceived as being awful is because of delayed care. It can take forever to get a doctor's appointment. And maybe not with the initial work comp doctor, but with the specialist. I've seen wait times for specialties like urology that can take 3 to 4 months. Psychology, 5 months just to get the patient in to be seen. And so that does nothing, right, to embolden your trust of the medical community when we can't even get you in to be seen within a reasonable time frame. And there's a lot of reasons why that exists, but it really impacts the way that our patients see us, right? Some of you, when you got hurt, your insurance company for your employer, they may have sent you to a, what I like to call chain occupational medicine clinic. And sometimes these chain occupational medicine clinics, they treat you like you are on an assembly line. You are merely a cog in the wheel. And that experience is no good. You're probably better off finding an OCMED clinic that's more boutique in terms of it's not a large chain. The care is a lot more individualized and one-to-one rather than seeing how many patients we can run through on a given day. And a lot of the folks that are in these chain OCMED clinics, they've not been residency trained in occupational medicine. A lot of times you have folks from other specialties who decide that they want to come into occupational medicine, and the mindset around how you treat an injured worker is very, very different from primary care. It's very different from internal medicine, very different from family medicine. And so when you have a provider who has not been trained in occupational medicine and they decide that they're going to go to a chain OCMED clinic and see patients, the experience can get a little wonky just because they, quite frankly, don't always know what they're doing. So, I've outlined some of the problems that we see with providers in the occupational health space. Where does that leave you? What is the solution? Well, my suggestion to you is to do some research and find a good occupational medicine doctor with a good reputation in your local community. Call your adjuster and request to be changed to that provider. Another option is to call the clinic where said provider is working. Or if you don't know any of the providers at the clinic, call the clinic, speak to the front desk, and ask them, if you were hurt, which of the doctors at your clinic would you go to? And based on what they tell you, that's who you schedule your appointment with. So I hope this video kind of gave you peace of mind. It kind of, what's the word? It let you know that you're not crazy. Hopefully this video was encouraging for you. Send it to a friend who's currently going through their work comp case. And if you found a work comp doctor that you love, or at least like, or at least respect, put their name in the comments along with the state where you found them so that other people in your community can reach out to them too. Email me a question if you have one about your work comp case. This is the perfect time to email me because this is my first YouTube video. And so I will be able to really cater to my audience one-on-one in a way that I may not be able to as the channel grows. So I am here for you. Like, subscribe, comment. This is the Work Comp Doc, and we'll see you on the next one.